Fabio Nahas from the Federal University of São Paulo. Recently, we have published an article in the July 2015 issue of Aesthetic Surgery Journal. The article is entitled, "Does diastasis with it influence the variation of the intra-abdominal pressure after correction of rectus diastasis?" So what is the most important finding of this study? We have shown that the width of diastasis does not have a direct correlation with the intra-abdominal pressure. And in other words, that means that the intra-abdominal pressure will depend on the laxity of the abdominal wall, not only the amount of correction that we have during correction of diastasis. So what can I recommend to the colleagues when correcting the myoponeurotic defects? After doing the correction of diastasis, if there is still some laxity, we should go ahead and do a nail application in the external oblique aponeurosis. That will help to reinforce the myoponeurotic layer as a whole. And that was described by us in 2001. Now, what is next? We have done a couple of studies with the intra-abdominal pressure and the femoral vein flow. We have studied the intra-abdominal pressure in all the instances during an abdominoplasty. So we did application of the rectus muscles, we have corrected diastasis, and we have found that there was almost no increase in the intra-abdominal pressure. We have done the applications, there was almost no increase also. But when we have put the garment, the compressive garment, the amount of pressure has increased in 3 times. So we wanted then to know what would be the repercussion of the increase in the intra-abdominal pressure. And we have done another study, which is the study using color Doppler to evaluate the flow in the femoral vein. And we have demonstrated that there was a decrease in 30% of the flow, of the speed, when we put the compressed garments. Now we are doing a randomized clinical trial on which we have separated patients that will have these garments used in the post-operative and those that will not have it. And probably we will be able to show in the next future some results with this, about this study.